Tell me, why do you do this?
To bring life into the world is phenomenal. The idea that you can make a life and then that life branches out to another life, which branches out to another life, is very compelling. It's wonderful.
You've certainly helped a lot of people I know, that's for sure.
I've helped a few.
Maybe in your own words, you can tell everybody a little bit, who is Dr. Sami David? What's your background, your philosophy, your general approach to making babies?
After leaving medical school, I spent 1 year doing straight internal medicine, which was wonderful. It gave me a perspective of a medical doctor, internal medicine, as you would approach any patient. Then I decided to switch to OB/GYN. Then in 1976 came the very first year that they had a fellowship in reproductive endocrine infertility. So that 1 year of internal medicine, and of course I think my medical school put things in perspective too, is you approach the problem and look for the underlying cause, not just the treatment.
And how long have you been doing this?
I've been here since 1978.
Wow.
So some of the pregnancies I've created are already, sad to say, in their upper 30s or even 40 years old. Someone has to be a voice for the woman. And I'm so damn sick, forgive me, of reviewing charts, and sure enough, the IVF doctor very predictably, it's your eggs, nothing to do with your husband's sperm, it's your eggs. And don't forget about the man, because men tend to be getting a pass on this. And it still is a fact that infertility is 40% of the time due to male factor. So yeah, I'm a feminist. Don't tell my patients it's your eggs. Prove it.
Are you an alternative doctor? Because it seems low tech, and for some reason there's this bias towards high tech.
Yes, there
high
is.
tech.
Oh, I think I follow good medical practices and follow it correctly. I know someone apparently that was brought up recently. One of my patients said about what I was recommending for a patient out of state. Said the doctor said, "Is Dr. David an MD? Like, why is he doing all this hocus pocus stuff? Because it works, maybe." And I'll use fertility drugs. I'll do inseminations. I'll recommend IVF. I'll recommend surgery. But let's start out slow. All of us trained with infertility, but they branched out into high-tech stuff. I said to myself, and this is going back into the mid-'80s, I said, you know what? My success rates are as good as IVF. If you can accomplish the same thing with minimal damage to the patient, minimal invasive testing to the patient, why would I want to switch? So it's been pretty consistent over 40 years.
One of the first differences that you notice when you walk into your office is your office space. It is calm, it is beautiful, it is welcoming. It's like nowhere I've ever been before.
And it's the result of my wife, Rena Shulsky David. She was the founder of Green Seal many years ago. So she insisted that the office be completely organic. All paint is non-VOC paint. All the wood that is used is coming from forests that are regenerated forests. The carpeting is non-toxic. All this speaks for her vision that life and the world around us should be as healthy as possible. Things should be organic, should not toxic. Every patient that I see, I also make them aware of the website ewg.org. It is meant to be calming, and it's meant to feel like a pleasant living room or something.
Being welcomed.
Yeah, all the colors, if you see, are warm colors.
Well, this is the most beautiful environment. I call you the miracle on Fifth Avenue. You really are.
Thank you very much.